Welcome back. Longevity medicine is everywhere right now. We're talking about supplements, IVs, and biohacking as people are spending real money trying to slow aging. Aren't we always trying to slow aging? So you may be wondering what's real, what actually works, and how to figure it all out. So we've got Dr. Georgine Nanos of the Kind Health Group with us this morning. Dr. Georgine, good to see you.
Good morning, Allie. It's so good to be here.
So, I mean, everybody wants the longevity potion, right?
Yes.
I mean, I think that it's hard because we know that with some of modern science that you hear these new supplements, you hear these things that are really going to be that special elixir to help us stay young forever.
Yeah, the fountain of youth, that's what everybody wants, right? So the longevity at its core means being able to stay healthy, functional, and vibrant for as long as possible. But there is so much out there. It's become such a buzzword, and it's hard for patients to discern what's hype and what's real. And at its core, we still get back to the fundamentals of prevention, and that's focusing on your sleep, managing chronic stress, making sure your cardiac and metabolic health is optimized, and then looking at our brain function and maintaining muscle mass as well. And there is so much hype out there right now. I think the key is if you're being sold something with urgency, like if you hear buzzwords like, hey, your doctor doesn't want you to know this, or you're aging much faster than you think, or this is, these 100% guarantees, those are things to beware of. So those are kind of some of the things to watch out for, because it is complicated out there, and Instagram and Facebook are really making it even more so.
Well, and I think the other thing to be aware of, right, is that they are marketing for you. So
Yes.
You need to do your research. You need to look into it more than maybe, just the Instagram ad that you're getting.
Yes, 100%. And it is a $1 trillion business. So we have to remember that you are being marketed and sold to. And so wellness advice is not the same as medical advice. So when you're seeing something on Instagram or Facebook, and everyone professes to be an expert these days, they're cellular repair experts and detox experts, and a lot of people claim to be doctors, but really accountability and credentials and training matter, because in this country there are only two degrees that are actual certified medical doctors, legal medical doctors, and those are MDs and DOs. So unless you see MD and DO after someone's initials, they're not actually real medical doctors, that are truly able to practice medicine. So that's a big thing to look out for. And then supplements. Supplements are everywhere these days. Again, wellness is this $1 trillion industry, and supplements are not benign. Even just because they're not being prescribed by your doctor doesn't mean they're benign. And at least every 6 months we see people who end up in the hospital from supplement toxicity. People taking 20, 30 supplements at a time, and your body can't necessarily process them. Some of them can actually cause real harm. So it's really important, if you're going to do that you discuss it with your doctor, because they do have some serious adverse effects.
Yeah, because your doctor's going to know. And at the end of the day, it's always moderation. That's what we all hear. Moderation,
Yes.
no matter what it is that you're doing, is going to be the key
Yes.
at the end of the day.
Yeah. Focusing again on those key fundamentals, making sure that you're sleeping, making sure that your chronic stress is managed, and your cardiac health is really, really critical. People don't all of a sudden have a heart attack out of nowhere in their 50s or 60s. It's because it starts years and decades earlier. So focusing on that prevention, knowing your cholesterol numbers, knowing your blood pressure, those are big risk factors for heart attack and stroke, and they can be mitigated much earlier in your lifetime if you are aware and taking those measures. And then brain health is so important. So chronic stress really, really ages us very, very quickly, as a lot of us know. And making sure that your brain health is optimized by sleeping well, because if that goes off the rails, then you've got chronic stress, cortisol levels super high, inflammation, and everything kind of trickles down from there. So it's really about eating well, staying healthy, exercising, and doing all those things that we talk about all the time, not smoking, alcohol in moderation, all that good stuff.
All right, Dr. Georgine Nanos, always bringing us all the information. Thank you so much.
You're so welcome.
All